All right, so today we'll be discussing about Chikungunya virus, focusing on the pathophysiology, transmission, treatment, and prevention. Chikungunya is a mosquito-borne virus and is known for causing onset fever and joint pain. So here I'm giving a little introduction about the virus. The disease actually comes from a word in the word Chinkungunya language, meaning that which beats up, referring to the posture of the people suffering from the painful joint inflammation that it causes. On the next few slides, I will be covering what the virus is, how it spreads, how it affects the body, and the strategy it has with managing and preventing the infections with my fellow peers. So with the transmission, it is spreaded by two types of mosquitoes. The mosquito becomes infected after biting into a vermictic person. Virus spreads to another person through the mosquito bite. There's no person-to-person transmission. Sometimes there's rare vertical transmission from mother to baby at birth, which we will go into detail in a later slide. And mosquito bites happens usually mainly during the day, and sometimes through nights, usually when people are like the most active. So, so the virus itself is a single strand RNA virus that belongs to the Togaviridae family, and it primarily affects tropical and subtropical regions where outbreaks can affect up to 75% of the local population. So here is the early entry. So when a affected mosquito bites a person, it affects the Chikungunya virus into the skin, into the bloodstream. The virus looks for a certain cell like fibroblasts, which are found in the skin, muscles, and joints. On the surface of those cells are special receptors. Think of them like docking ports. The virus used them as its own surface protein called E2 to attach the receptors and gets pulled inside the cell through a process called endocytosis. Basically, the cell swallows it when it eats it up and it gobbles. So once it's inside, the virus releases its RNA, which is like a set of instructions because the RNA is a positive sense. The cell can immediately read and start making the viral proteins. So the first protein makes a non-structural protein form and replication complex, like a kind of virus making factory. This factory copies the RNA many times and then makes the structural proteins. Uh-oh. So it, sorry, makes the structural proteins to build new viruses. These new viruses then move to the surface of the cell, butts out, and separates to the infected nearby cells and tissues. That's how an infection expands in the body within a few days after the mosquito bite. So technically, I can give you like a case by case, like a step by step scenario on how the mosquito affects the person. The mosquito bites an infected person who currently has the chikungunya virus circulating in their blood. The virus enters the mosquito mid-gut with the blood meal and replication there. It spreads within the midgut to the mosquito's body's cavity and salivary glands. Now the mosquito saliva contains the infected virus. It is ready for transmission. It can be ready to be transmitted to another person. When the mosquito injects the saliva containing the virus, um, into the person's skin while feeding, the virus infects the skin fibroblasts, immune cells, and the endoviral cell near the, the mosquito bites. Inside the human body, the virus enters the cell by receptors mediating endocytosis. The E2 protein binds to the receptors of the MXRQ8. After fusion and uncoating, the viral RNA is released into the cytoplasm. The RNA acts as an mRNA producing non-structural protein and forms the replication complex. New viral particles are made, released, and spread through the joints, muscles, and blood, leading to fevers and severe pains. If another mosquito bites an affected person, the cycle continues all over again. Um, so, with the innate immune system in our body's first line defense, um, when the virus first enters our cell, recognize its special sensor called pattern recognition receptors, also known as PRRS. These receptors detect viral RNA and alerts the body that something foreign is presented. So with the adaptive immune system that can take over later, they use the dendritic cells, shows pieces of the virus, which is the agents and the T cells that are in the lymph nodes. So after recovery, some of these B and T cells become memory cells, which means if the virus ever come back, the immune system can respond faster. That's how long-term immunity develops. So why the joints hurt? So with that, so the sorry, the Chinkungunya causes joint pain because the virus goes into the bloodstream and settles in the muscle and joints. It affects the cells that lines within the joints, called the fibroblasts, which I discussed in previous slides. And this causes irritation and inflammation. The immune system then reacts to the release of inflammatory chemicals like the IL-6 and the TNF alpha to fight the virus. These chemicals bring the immune cells to the joints, which leads to swelling, stiffness, and pain. So the pain comes from both the the pain comes from both the virus damaging the joint tissues and the body's immune response to protect you. So it's kind of like your body is fighting itself. So even after the virus is clear, viral RNA can remain in the joint tissues for weeks and for honestly up to months. And this is what caused the persistent inflammatory response. The immune system continues to respond to these factors and causing chronic inflammation similar to rheumatoid arthritis. And this is why some patients experience long-term uh, joint pain, which is post-viral arthritis, lasting months to even years. So some severe diseases or at-risk groups are women who are pregnant, infants and children, and older adults, mainly 65 and older. So now I will be passing this presentation to Gia, what she will discuss the disease, how the disease spreads, and its clinical course.
All right, so I will talk about hair disease spread and clinical course. Before going to my slides, I have a little video to show they were talking about chikungunya virus and their traveling warnings.
Let's turn now to a health alert. The country where COVID pandemic began is now a hotspot for an illness spread by mosquitoes. Health officials in China have ordered a mass disinfection measure. As CBS News Miami's Rami Inocencio reports, the region near Hong Kong has reported more than 7,000 cases in recent weeks.
From above, drones sprayed anti-mosquito agents as workers below sprayed streets and apartments of Guangdong province in southern China. This painful mosquito-spread virus is called Chikungunya, first identified in Africa in the 1950s. It causes severe joint aches, fever, and fatigue. And after once a century rainfall in China is now flourishing, prompting the Centers for Disease Control to release a level 2 travel warning, urging Americans to, quote, practice enhanced precautions if traveling to parts of China, Bolivia, and much of the Indian Ocean region. In response, China's foreign ministry spokesman said the current situation is preventable, treatable, and controllable. Beijing has learned strict, fast containment lessons fighting SARS in 2003 and the COVID epidemic since 2019. Doctors have forced patients to stay in hospital for 7 days to stop further spread. While there is no cure for chikungunya, most patients do recover in a week. China fighting to stamp out this virus fast. Rami Inocencio, CBS News.
All right, so I will start how it spread. Chikungunya spread through the bite of infected Aedes aegypti and Aedes albopicus mosquitoes. These mosquitoes are mainly active during the daytime, especially early in the morning and late in afternoon. When a mosquito bites a person who has the virus in their blood, it become infected and can pass this virus to other people. The disease spread more easily in warm tropical regions where mosquito breeds in standing water nearby their homes. Urban growth and travel change in climates also helps these viruses spread to new areas around the world. The next slide is vertical transmission. And in most cases, chikungunya virus can be, especially can be passed from a pregnant mother to her baby during their childbirth. The risk is highest if the mother is infected near the time of birth or a delivery. Most newborns who become infected may develop fever, poor feeding, irritability, but it's safe. But pregnant women living or traveling to outbreaks areas should be monitored closely during their late pregnancy and if the mother is viremic, which is called virus in their blood. And especially they have to monitor like more closely when it's time to give to a birth. The next slide I will talk about here is incubation and symptoms. So after a person is bitten by infected mosquito, symptoms usually appear within 4 to 7 days. The illness begins suddenly with high fever, intense joint that can make it hard to move, especially your wrist, your hands, your ankle. Some people may develop rashes, headache, muscle pain, fatigue. The symptoms typically last for a week or two, but joint pain and stiffness can continue for several months. Typically in older people, adults, although it can very painful, but chikungunya rarely cause serious illness or disease, and the symptoms usually last 7 to 10 days. In this slide, I will talk about chikungunya, dengue, and Zika. So chikungunya, dengue, and Zika are all spread by the same Aedes mosquitoes, and their early symptoms can look very similar. But however, there are key difference between them. Chikungunya causes sudden high fever and very severe joint pain, can last for weeks or even months, depends on your immune system. Dengue often leads to bleeding tendency and low platelets, which can make it more dangerous. Zika is usually mild and may cause rash, low fever, and red eyes. Long lasting joint pain is what is um, mainly separates that chikungunya from the other, because with the chikungunya, you have a very like bad joint pain. You have a stiffness. Next slide, I will talk about like clinical diagnosis. So doctor can often recognize chikungunya based on patient symptoms and recent travels history. To confirm the diagnosis, the doctor will do like different laboratory tests. They were used. PCR testing can detect the virus during the first week of illness, while antibodies testing like IgM and IgG ELISA testing show up after a few days as the immune system reacts. And in specialization labs, the virus can be isolated from blood samples. Since dengue and Zika are same, like share similar symptoms, accurate testing is more important to identify the correct infection and provide the right care. Like for example, nowadays, um, people are again having COVID, some people are getting flu. So when we go to the doctor, or especially kids are going to the doctor because they are going back to school, they will do the testing on the kids to see if they're having a flu or a viral infection. So I think it's very important to go to the doctor if you know if you are traveling to other like especially Asian places. You can come back and you see your symptoms. Typically, you go to the doctor and they will do the lab testing and they will find out what is going on or you got the virus. The next slide I will talk about here is history and outcomes. So most people with chikungunya recover completely with 1 to 3 weeks. However, joint pain and stiffness can continue for several months, especially in older adult or people with arthritis. Some patients also experience long-term tiredness, mild depression, or difficulty with daily tasking because of a lot of pain and stiffness in joints. Several disease is uncommon, but may occur in newborns, elderly people with weak immune system, complication affecting heart, nerve, or eyes, and rare death from this disease. But some people develop lifelong immunity and cannot get infection again. So with that, I think with early management is with hydration, rest, anti-inflammatory medications, helps reduce pain and speedy recovery. I will pass to Victoria and she will get to explain more about special population and pharmacotherapy.
So even when there is not like a cure for chikungunya, there is pharmacotherapy and treatments that we can use to manage the symptoms. So that's what we'll be talking more in depth. So the main thing when we talk about supportive care, the first thing we want to target, since there's non-specific antiviral therapy approved for chikungunya, like I said before, the main goals is going to be just to address that fever, pain that is on the symptoms. So we're going to start by encouraging our patients to have a good rest and fluids, which means a lot of hydration. This would include drinks with electrolytes, not only water. And we're going to see that we have some special populations that might also need IVs or any other type of fluids that may require them to go to a doctor or even the ER. And the good nutrition always is important to support. Some people will experience less appetite, so it is highly necessary to let them know the importance of eating well while the chikungunya is in there. When we go with pharmacologic, is something that they can actually take. Is most of them will be over-the-counter medication like acetaminophen for the fever and the pain. We want to avoid aspirin and NSAIDs like in dengue because the risk of bleeding. We'll see that patients that have chikungunya, like patients with dengue, might have their platelets low or their hemoglobin might be affected. So anything that can cause bleeding, we want to just avoid that. Once the chikungunya has been ruled out, that time has passed, let's say 1 to 2 weeks, we can start talking maybe about some NSAIDs to manage the joint pain because it can be very chronic. The overview and about the management at the end is going to be that we don't have any specific antiviral, like I said before, but to treat those symptomatic and support the patient. So at the end of the day, the goals are going to be to relieve fever and pain, maintain the hydration and rest, and prevent any complications. We'll see in the next few slides that special population might have some complications that we want to keep an eye constantly. Special populations, we're talking like usual, children's, elderly, pregnancy. So I'd like to start by the children's and the elderly population, since their immune system for the children's is not fully developed, and for elderly usually is more compromised. They're going to be at a higher risk for this severe disease. And when they say severe, is that their symptoms are going to be worse. The joint pain will be much worse. Keeping them nourished and hydrated is going to be more difficult for children, of course, because they have less appetite, they feel that discomfort, and we are trying to keep them hydrated and eating constantly, which is not easy, sorry. And for elderly, it's kind of the same situation, right? Trying to convince them to eat and drink enough fluids. So for these populations, we're going to see a lot of hospitalizations so they can keep the electrolytes balance through IV intake. The possible complications are going to be those neurological symptoms like encephalitis and seizures, because the immune system becomes compromised and they start presenting more. They can develop other disease, or they can actually catch easier or faster other type of conditions while they're at the ER or out there because their immune system is not working as well. And the dehydration from the fever and poor intake can lead to serious complications in children's. Dehydrations can get them to a electrolyte imbalance that lastly can become a seizure with neurological problems. And once again, we want to avoid aspirin and NSAIDs in children's unless we are 100% sure they have not dengue and it's chikungunya, since chikungunya and dengue is kind of confused between itself. Now talking about the pregnancy and women that may be breastfeeding or lactation. In pregnancies, the vertical transmission will occur if the woman becomes infected near the delivery. If they're in the first, second trimester, the possibility of that baby having the infection are pretty much none. The associated risk we can see in pregnant women with this condition is going to be a preterm birth, low birth weight, or newborn infection if they get infected near that delivery date. And we are going to see this risk not because the virus itself, but the complications of the virus. Because if they are not, once again, eating well, hydrating well, then the baby is not getting the nutrients, so it's going to have a low weight when they get burned, or the distress of the body can cause a preterm birth. There is no evidence at the moment of congenital malformations like it happens with Zika. Chikungunya, we have nothing report at the moment related to that. The management, once again, like in all cases, is going to be supportive. We are going to try acetaminophen, always nothing like aspirin, especially in women with third trimester because of the bleeding risk. And if that woman becomes in the preterm birth, we are getting into serious risk effects at the birth of the baby because of the aspirin. So we're going to avoid aspirin at all costs. Breastfeeding is safe. The virus is not going to be transmitted by the breast milk. So women's lactating can keep lactating. There's no problem with that. Um, they can continue their breastfeeding to support the infant immunity and hydration and ensures that adequate rest and hydration like all the patients. We're gonna make sure that they're actually keeping themselves as healthy as possible. Now, when we talk about prevention and current vaccine status, I want to put a video at the beginning. I'm gonna play it in just a minute because it is important to be aware of all of this type of viruses and diseases because we are not in any, we cannot prevent 100% not getting them, even if we are in the United States and not in a tropical region. And that's, let's see the video first.
A health alert about a serious mosquito-borne virus rarely seen in this country. It may have arrived on Long Island.
The disease is called Chinkungunya. A 60-year-old woman from Hempstead tested positive for it in a preliminary exam, and now the New York State Health Department is investigating.
Eyewitness News reporter Stacey Sager talked to an expert about the possible concerns.
As our late September days feel more like summer than fall, it's no surprise mosquitoes hang on longer than ever before. And with this, troubling news out of Nassau County, the New York State Health Department confirming they are investigating a possible locally acquired case of chikungunya virus. Their statement went on to say no locally acquired cases have ever been reported in New York State, and the risk to the public remains very low. What we know is a 60-year-old woman from the town of Hempstead told the New York Times she tested positive in a preliminary screening this month, that she was stricken with severe joint pain. She also told the newspaper she had not traveled anywhere recently, and that's what makes her case different from others found in our area in the past.
When we normally see dengue or chikungunya in the United States, it's from someone who's recently returned from an area where there are infected mosquitoes, so usually in the tropics.
But experts say because of the prolonged warmer temperatures in our area,
the mosquito that normally carries it is now able to live in the northeast of the United States where it previously could not. And its cousin is now also able to carry some of these viruses that are all in the same category as yellow fever.
the virus is not transmitted person to person, only by mosquitoes, and its symptoms do include fever and chills, but mostly the joint pain the woman described.
There can be chronic kind of arthritis, chronic inflammation of your joints for months to even years after the infection.
This means more testing of local mosquitoes to see if any come up positive, and the basic prevention methods such as local spraying, repellent, and staying away from standing water at dawn or dusk. The health department says it'll make their results known as soon as possible. I'm Stacey Sager, Channel 7 Eyewitness News.
So, like we're seeing, there is a possibility that chikungunya has arrived to the States with all this global warming and everything that's been happening with the climate changes. I'm not surprised about it. Me coming from Puerto Rico, I know pretty well that chikungunya even had it as a kid. And yes, this is, I just wanted you guys to see that it's relevant to everyone, even us that we are here on the state and maybe we don't see that becoming a reality to us. It might be possible now. So that is why it's so important to know the personal protective measures and also the community ones. But I'm gonna start by the personal. These are some of them are recommended by the CDC. Others I found them as I was doing my research around all of this scientific information and papers. So using repellents like DEET, whales, long leaves, because we are gonna try to not get bite by these mosquitoes. So using mosquito nets, if you are going camping, doing something on the grounds, we're gonna try to avoid getting in contact with any mosquitoes. Install windows and door screens if you are living in a zone that you keep your windows or your doors open. There is chemical control if needed, like larvicides or water that cannot be emptied when you have a water tank or some water that you cannot actually empty the container and you gotta keep it. There is chemical products to avoid the mosquito larvae to grow. Adulticide spraying during outbreaks to reduce infected adult mosquitoes. So trying to eliminate as much as possible the mosquitoes. And this chemical control, they need to be coordinated with the public health authorities. It's not something that we can do. And I can recall me as a children in school when in Puerto Rico there was a big outbreak of the chikungunya. Everyone was bringing the repellents to the school. They want you to wear long sleeves. As the time passed, people get to use like any other virus and disease, and it's not as bad right now. So community vector control, how as the community we can prevent any outbreaks like in big masses or big populations. And this is pretty important because when it's a sustained convenient, when the community get involved together, like sustainable, they actually can reduce a lot the population of these mosquitoes and prevent not only chikungunya but other diseases and viruses that we know they're transmitted by mosquitoes. So our purpose with the community control is to reduce those mosquito populations. In this case, we're talking about the two species that actually can give you chikungunya and interrupt their transmission cycle. If they're already in our community, we want to avoid them to keep reproducing themselves. Environmental control, it is eliminating breeding sites, and this is pretty much anywhere where you have standing water containers. You want to remove that water. You don't want any water to get contained or together because lately mosquitoes can reproduce themselves on those waters. If there is a specific water container that you have to keep that water in there, then taking the measures to cover and make sure that non-mosquitoes can get into that water. Also, if you have pets, you want to change their water and the vases continuously. They will say weekly, I'll say daily, because we once again want to avoid this as much as possible. And community cleanup campaigns, that is to promote local participation and awareness. Sometimes communities get together and they will clean if they have a park or they have like community spaces around the neighborhood to make sure there's nothing, no waters retained anywhere that can promote these mosquitoes. There's two approved vaccines for chikungunya, but they're not required. It's not like the flu every year or the COVID. So the campaigns on them, they're not that big. They're just now licensed in the United States. One of them is live attenuated, and there is like virus-like particles vaccines. The live attenuated one is from 18 years or 18 years old people or older. It's a single dose intramuscular dose for both of them, but this is something new, so we haven't heard that much about them. What is the pipeline and the development? Where what we are seeing in the future about the chikungunya? Because as we see, it's spreading more. This the China news is 2 months old, so this is recent. China is having a big outbreak. The United States one in that we just saw in Long Island is from 2 weeks ago. So we're not talking about something that happens years ago. We're something that is happening right now. So the pilot and develop, they're trying to develop another vaccines that are actually right now in their clinical and preclinical trials. And one of them, they're talking about mRNA vaccines. We know that vaccines are moving more into the mRNA or other type of technologies that did not incorporate the live attenuate. They're trying to like stop use live attenuated agents since it's not like people don't trust that much as a community on that. So they're working more on mRNA or vaccine particles ones. And their approach is to target E1 and E2 envelope proteins for strong neutralization response. So it's not to protect you for getting the vaccines, it's to prepare your body if you get the vaccines, have the symptoms neutralized. Like everything, there is some challenges and goals when we talk about development more vaccines. Some of the challenges is a high production cost. Not only the production, but the studies to create these vaccines, they're really, oh my God, high cost. So it's kind of hard to find funding for them. Also, it's limited availability in the endemic countries. We're gonna see that some of these tropical regions where we have a lot of chikungunya, they're not as developed as other places, so it's hard to them economically and even as technology-wise to get these vaccines, and that they will need to be licensed globally by the WHO pre-qualifications in order for us to, let's say United States now that have two of them licensed, if we want to export them to this part of the world that they may not have the access as us, we need the WHO to actually license us, not only in the state but globally. So the goals is going to have long-term protection, have fewer doses. And we saw that the two that are licensed right now, they're single dose. So it seems that we are going in a good path towards that, and safe use in pregnant and pediatric populations, since they are some of the high risk populations, special populations. We always want to find a way to target those populations first. Safety, equity, and access to this possible treatment in the future. The safety monitoring, ongoing post-market surveillance is something really expensive. When you put something new out in the market, you need to have a way surveys or to see if it's working or what are the side effects, and it is one of those challenges. Equity concerns must affect populations living in low-income tropical areas. Like I mentioned before, these tropical regions doesn't have as much access, and it will be hard to get them vaccine where it's actually needed. Vaccines roll out limited by manufacturing and logistics, and WHO and CDC emphasize combining vaccination with vector control and public education. As we are doing right now, we're trying to keep the vector control and educating our community as much as possible while those vaccines start coming out there. The key message about the chikungunya is a preventable mosquito-borne disease. And even when it's not 100% preventable, because we can do our best to not get bite by a mosquito, but we never happen. If we follow the community vector control, if we are going around our houses and making sure during those rain season that we don't have any containers that they may get some water cup in it and then the mosquito will get spread, it will help us to lower or decrease the probabilities of getting infected. Early diagnosis, of course, is always a goal, and vaccination, being able to actually get a vaccine that is not that high cost, and that everyone can get access to that. So we have some multiple choice questions to see, and I'm gonna actually discuss them. So, which vector primarily transmits chikungunya to humans? And we should know the four of them right now. The first one, that is Anopheles gambiae. This actually is for malaria, not for chikungunya. So we already know that A is not an option. Um, The C, Culex pipiens, is arbovirus. Sunflights is leishmaniasis. So that and then also we already said that there's two species. So Aedes aegypti and Aedes albopictus, if I'm mentioning that correct. In the first week of suspected arboviral illness, like chikungunya, which is a safe antipyretic before dying is ruled, or any disease that can be affected by aspirins, we know it's going to be acetaminophen. And that we are going to try to avoid aspirin as much as possible. If we need to use any naproxen, NSAIDs, or aspirin, is when 1 week or 2 weeks after the person start having the symptoms, and it's to manage that joint pain, arthritis pain. Okay. And let's go to the next one. One is mother to child transmission of chikungunya, most likely. First trimester, we said that there is low, known chances. Same for the second trimester, so these two. Perinatal period, when the mother is viremic at delivery. This is the one because we already said that the breastfeeding is safe when you have chikungunya. What best explains persistent post-chikungunya arthralgia, which is a joint pain, muscle pain. And here we go. So ongoing high level viremia for months. It is not because we already said that by the first 1 to 3 weeks, that will take the virus to be out of the body. So this is not an option. Oops. Oh, I did something weird here. There we go. Oh my God. There we go. Immune-mediated synovitis involving stromal and myeloid cells. That might be something because we're talking about the immune system. Bacterial superinfection of joint is not because we're talking about a virus, not an bacteria. Auto antibody negative osteoarthritis only is not usually when something says only, it's not the option. So we're talking more about the immune-mediated response of our cells. What is the current status of the live attenuated chikungunya vaccine? We already talked about there's 2 licensed, but right now they're actually pending the safety review. So they're not fully available for adults. They're not recommended only on 65 years old because we already mentioned one of them is for 18 plus and the other is 12 plus. So it's not mandatory because it's not out there. We have 2 licenses. They're suspended because we're waiting for the safety review. So if they pass the safety review, we're going to have those 2 out and be able to administer them. And these are actually the references for where we subtract most of the information. We use CDC, WHO, and other scientific one. I don't know if my cousin want to add something at the end, but I just gotta say that chikungunya, we just gotta keep it in mind that we want to avoid those mosquitoes around the house or any others, because as we saw in the first questions, mosquitoes can get us in trouble. So it's always good to keep prevention as a high priority. And as we know about chikungunya, thank you so much for your attention.